Good morning. This is Terry Kuti, founder and director of Deep Sea Foundation, and I'm sitting with Dr. Minas Chrysopoulo today with PRMA in San Antonio. Dr. Chrysopoulo and I both have a very favorite topic that we like to discuss, and it's shared decision making. But today I want the viewers to know about a tool that helps you in the shared decision making process that was developed by Dr. C, as his patients call him, and it's called the Breast Advocate app. I'm going to let him take over. I like to tell other women about it, other men about it, doctors, nurses. I've shared this, so you tell us about the app.
Shared decision making in your hand.
Yes,
right?
in the palm of your hand.
So I've been treating patients who were diagnosed with breast cancer or were at high risk for breast cancer. I've been treating them for many, many years, and it got to the point where got tired of hearing the same thing from them, the same complaint, which was, had I known about whatever, fill in the gap, I would have done something different. So, and then looking out there, there really wasn't a good option in terms of a tool, a decision aid to help people get to the place they needed to be, to find out really what was best for them, that took their preferences and situation and values into account. And that's what shared decision making is. So you can easily go online and find the options for, based on your diagnosis, the different types of treatments, different mastectomies, different reconstruction. You can find all that online, but there isn't much out there that really guides you through the process of determining what's best for you, and that's what Breast Advocate does. So it's not just for breast reconstruction. I was very, very lucky to get some excellent people involved. You've been one of them.
Thank you.
No, thank you.
Yeah.
So you remember all the patient advocates we had involved on the advisory board in terms of the content, and all the surgeons from different specialties too. So we have lumpectomy covered, oncoplastic surgery, which is reconstruction at the same time as your lumpectomy, with or without a symmetry procedure on the other side. Going flat for women that prefer not to have reconstruction. That's often an option that's not even on the table for people, that's discussed. And then, of course, all the options for breast reconstruction. Lymphedema is in the app. Male breast cancer. Prophylactic surgery or risk reducing surgery, which is a better way of talking about it. We have a wizard function that really is the core feature. It's the unique feature of the app that asks a few questions.
That's the personalization part.
Exactly. It asks a few questions, and then based on the user's answers, the wizard gives recommendations, a list of recommendations. Sometimes it's it can be several, sometimes it's only one, depending on the situation. It's usually a few. And those recommendations are the combination or the marriage of the patient's preferences and what the evidence says. So it's evidence-based medicine combined with the patient's preferences to provide recommendations that then they can take to their doctors and discuss. So this is not specific to our practice, although we obviously use it. We send a link for people to download it before they come in for the consultation, and that really saves a lot of time. It gives them the opportunity to go through all their options at their pace. They're not rushed, and they're armed with the right questions before they even come to the consultation. So a lot of doctors are using it in that way. A lot of nurse navigators at breast centers like it because it helps them work out what the patient should be asking. And it's going down really well. We just launched version 2 not too long ago. And we have also a blossoming community within the app too, which is kind of fun to
Right.
watch.
I
So,
think from my
all good things.
perspective, you know, as a lifelong educator, the important thing from my standpoint, being able to personalize it, you know, on the Wizard is important. But it's again that vocabulary that we need to make the conversation, or to have the shared decision-making conversation. Sometimes you don't know what words to use, what terminology to use. It's all evidence-based. And the thing I like too is, even after you have whatever surgical option you have chosen, including your breast cancer care, it's all right there for you to reference as you're going through the healing process, the recovery. So I like to tell other patients about it, and other healthcare providers. So
Thank you very much. I
good
appreciate
app.
it. Yeah.
Check it out. breastadvocateapp.com. And I was just thinking, since my phone, sorry for the visual there, since my phone is sitting here, there's the,
It looks pink on that screen.
it does look pink, but
Yeah,
and
it's
then
not
the
pink.
wizard pops up, but
Yeah.
it's not.
It's not pink. Yeah.
Odd color on this.
We
But
specifically did not choose pink. We avoided pink.
thank you.
Yeah.
Thank you. Sometimes we
Yeah.
get overpinked.
Yeah.
Android and iPhone
And iPad.
and iPad.
And we're working on desktop.
Yep. Check
Yep.
it out. breastadvocateapp.com. Thanks for joining us today.
Thank you.
Absolutely.